Hi, I'm Dr. Jim Powell, and today we're going to talk about the MedX, the exercise equipment that we have on our second floor to help you strengthen your spine. The spinal rehab program has been available to patients at Powell Chiropractic Clinic since 1980, so we've been using this program for quite a long time. What we've identified in those 40 years of exercising patients is the stronger you are, the better you are. And so that applies to the muscles of your body, but also to your immune system and every other system that you have in your body. As you can see in this slide, the muscles of the neck attach to the skull, the jaw, the collarbones, and the shoulder. Those are the big muscles of the cervical spine. In the neck, the stabilizers are not only those big muscles, but the muscles in between the bumps of your spine. As you can see in a whiplash injury, which can happen in a fall or in a car accident, as the neck is brought forward, you can see in the slide how those tissue, that small muscle in between the bumps of your spine, can tear. It can tear in the front, it can tear in the back. Either way, it makes that area unstable. The big muscles of your neck, you will actually stabilize and strengthen by you doing some of your normal life. Those small ones in between the bumps of your spine, even if you are very active, you won't change those unless you isolate that area. As you can see, the muscles of the lumbar spine, the big muscles, attach to the pelvis. So the legs, the stomach, the buttocks, that all attaches to the pelvis. The small muscles in between the bumps of your low back are the ones that we want to address. In a low back injury, you injure the big muscles of your spine and the small muscles of your spine most commonly. The big muscles of your back, you do have the opportunity of strengthening on your own. You being active, working out in the gym, doing a lot of different things, you can. The small muscles in between the bumps of the spine, however, are far more difficult to strengthen. As you can see in that slide, the muscles that are green, the ones that attach from the base of your skull all the way down to your pelvis, are the big extensor groups. Those are the groups that you do commonly strengthen in the gym. The ones that we're about to show you are the ones that you won't strengthen in the gym without a specific piece of equipment. As you can see, the muscles between the bumps of your spine have lots of names. We're not going to quiz you on those names of those muscles, just know that they exist. Those muscles are very difficult to isolate. We found a piece of equipment that does do that for not only the neck, but the back. What you're looking at now is the lumbar MedX machine. Its entire purpose is to stabilize that pelvis so that when you push back with your back, you are not moving the pelvis, therefore isolating the small muscles between the bumps of your spine. As you can see in the test, the patient is pushing back against the pad and he gradually pushes from a small push to his maximum effort and then eases back off. We ask you to please do this in your test so that you don't have a jerking motion or injure anything that's already sensitive. The range of motion in the lumbar spine, she's going to establish to make sure that he has full range of motion and test the strength in each one of those positions. Now, when the time comes to do some exercises of this machine, it is called isodynamic. An isodynamic exercise is where we still have you pinned, where you can't move your pelvis. We put some weight on the machine and you're pushing back with your back against a specific designed weight. We're going to try to have you do 20 repetitions on this machine, and that'll be sufficient to get that session completed. Typically, we do 6 exercise sessions with a reevaluation to determine where your strength is. Provided that you're increasing in strength, we'll continue the program. As you can see, we also have the cervical machine. It's very unique as well. It isolates by pushing the shoulders back and down. It just gets the small muscles in between the spinal segments of your neck. It gives us the ability to test isometrically and then strengthen isodynamically. So one of the things that's asked quite a bit by our patients is how long is the results going to last? With 40 years of exercise under our belt, what we've figured out in that time frame is that there are 2 groups of patients that go through this machine. 80% of the population will retain the strength that they achieve of their neck or their back, provided that they didn't have an additional injury come about. 20% of the population even if they didn't have an injury, will lose their strength. What we've discovered is that in a chiropractic aspect, after the results have been achieved, your chiropractor will indicate or prescribe for you to get an adjustment periodically, maybe once a month. For the folks that have 20% of the population, meaning that they lose the strength of their neck or their back even after they've achieved it on this machine, an exercise is provided to them along with that monthly adjustment as a maintenance program. And that's how you can maintain what it is that you've achieved if you happen to be a 20% of the population. The way that we identify whether you're an 80% or a 20% is we retest your strength a few months later to see if you lose your strength. If you do, it would be wise for you to do an exercise once a month. I'd like to thank you for watching this video. It helps us help you when you're more knowledgeable. Physician in Latin means teacher, not doctor. Our job is to teach you about you so that you know what is it that you need to do for you.